finding out a lot already from Dr. Gary Goza. He's with the St. Vincent Sleep Center, and more people are realizing they are snorers and that something can be done about it. And it's good to have you. Welcome
Thank you.
To the show. First of all, I guess let's just talk about what causes the snoring.
Okay. Well, snoring, of course, is a noise that's made when you breathe in and out through your nose and throat when you're asleep. And the way I think of it is that you basically have a tube that runs from the front of your nose to your Adam's apple that normally transmits air, and when you're awake, that tube is wide open, and so the air flows smoothly and quietly. And when you're asleep, different things can happen. If your nose is stopped up, the air has some resistance, and so it creates some vibration which can cause you to snore. Most cases of snoring are due to muscles relaxing in the back of the throat, and when they do, then your airway starts to close off, and when the walls get real close together, you have to suck the air through, and it all vibrates, and that makes the noise.
That makes the noise.
Right.
Okay, and who snores more, men or women?
Well, men snore more statistically. It's about 2 to 1, but lots of women snore too, so I think for an individual person, it's not what sex you are, it's what you do. Of course, snoring is kind of a funny thing in movies and television, and everybody laughs about it, but it can be serious as well. Just the noise can interrupt the sleeping partners. People that snore can wake themselves up. But more importantly, if snoring is really bad, it often indicates that a person may have sleep apnea. Sleep apnea is basically the same process as snoring. It's just more extreme. And with apnea, everything relaxes so much that you don't get enough air through your airway, so that when you're sleeping, your oxygen level drops, and people actually stop breathing sometimes, and then they'll suddenly make a sort of a snorting noise as they rouse up. Some people can have apnea and not completely stop breathing, and so you never really hear them go completely quiet, but they just don't get enough air through their airway to keep their oxygen level up.
And we've seen extreme cases where it's been fatal.
It can be fatal, and certainly it's associated with more risk over time for heart attacks and strokes and high blood pressure, and so it's a serious problem. And sometimes we have to do sleep tests on people to determine, are they just a snorer or do they actually have apnea.
Okay, and if they do have apnea, then they might get one of these machines?
Right. There's several ways to treat snoring and apnea, and all the treatments are designed toward keeping your airway open. For people that don't have bad snoring, some simple things like I brought a Breathe Right strip.
Yeah, let me, okay, these things that you can buy over the counter.
Which you can put over the outside of your nose when you sleep. Sometimes they help. Most of the time for world-class snorers, they don't make any difference. But some people only snore when they're on their back, and they can, stay off of their back. If you lose weight, sometimes it helps.
Right.
But for people that are really having bad snoring and potentially having apnea, then it takes a little bit more aggressive treatments to help that. Sometimes surgeries help. It's kind of an individualized situation about whether someone's a candidate for that. Most people end up using the CPAP machine currently, and I brought one of the newer models.
Okay.
They're small. They're connected with a hose, and basically it's a fan that blows air through this hose, and at the end of the hose is either a mask, or this is showing what we call nasal pillows. These kind of go up into your nostrils, and as you're sleeping, you breathe air that has a little pressure behind it. That air, when it gets to the back of your throat, just pushes the walls apart, and it just kind of inflates your airway. It takes a little getting used to, but most people do well with it and are happy with the results. And besides not snoring, the person usually feels a lot better. Yeah,
most who I know use it, they don't want to sleep without it after they've gotten used to it. You wanted to mention these also can help.
Right. This is a new device that we don't have a lot of follow-up on long term. It's called a ProVent, and it actually goes over your nose. You tape it over your nose, and it's got a little valve in the middle, and when you breathe in, the valve opens up, and when you breathe out, the valve closes part of the way, and it has kind of like an effect like a CPAP machine. It's currently mostly used for people that just can't stand a CPAP machine, which there are some, but I think as time goes by, we'll get a little better idea about how that's going to be used.
Well, if people have any questions or they think they need to sign up for the sleep study, which is an overnight stay, correct? They can call the St. Vincent Sleep Center. Absolutely, and they will schedule you an appointment or perhaps a sleep study, and to see if you have this, because if someone in your family snores, or you've been told you snore very loudly, you probably need to have it checked out.
That's correct.
Here's the information all on your screen about that. The phone number 552-4910, Monday through Friday, 8 until 4 o'clock. And of course, that is the St. Vincent Sleep Disorders Center. Thank you so much, Dr. Goza. We could talk all day about this, I think, but it's good to kind of get updated on the latest information. Thank you.